There are two of America's biggest killers, coronary heart disease and stroke. But these deadly conditions have more in common than their prevalence. Many doctors say coronary heart disease and stroke go hand in hand because they have a lot of the same risk factors.
There are a number of preventable risk factors for stroke and heart disease. High blood pressure, high cholesterol, smoking, and primary lack of exercise, which will lead into obesity. So we know that these factors, if they're controlled, okay, we can probably prevent 4 out of 5 strokes.
Cardiovascular disease is the leading cause of death and infirmity in America today. There are many risk factors. Some of them are treatable, but many of them are not. The untreatable ones typically comprise things like your age, your gender, your family history, and your race.
While you can't control your age, gender, and genes, there are several simple steps you can take toward a reduced risk. First and foremost, don't use tobacco. It's the #1 cause of preventable illness. Get moving. Moderate exercise lowers your blood pressure, reduces cholesterol, and helps you maintain a healthy weight. Eat right. Avoid saturated fat, trans fat, cholesterol, and sodium. Watch your waistline. Obesity is a major risk factor. Avoid excessive alcohol. While 1 or 2 drinks a day may raise your good cholesterol, heavy drinking raises your risk. But the best thing you can do to reduce the chance you'll have a heart attack or stroke, make regular visits to your doctor.
A doctor's care can help prevent stroke and heart attack. They will evaluate the patient for high blood pressure and recommend medications, recommend dietary changes if their cholesterol is high, recommend exercise, and by exercise I mean walking, just simple walking, 30 minutes a day. The patient has to make up his or her mind to be healthy, but these little things can indeed reduce the risk of stroke or heart attack.
Learning all the signs of heart trouble is critical to early treatment. Stephen Benowitz made the dangerous mistake of ignoring the symptoms.
I go to the gym every other day. I spend about an hour and a half to 2 hours. And when I was riding the bike as part of my cardio exercise, I would get the pains in the neck and the jaw, and I would have to stop. When I was lifting weights, I never got the pain, so I just didn't think anything of it.
With the help of a medical professional and just a few simple steps on your own, you can avoid becoming one of the millions of Americans who suffer a heart attack or stroke this year. Stephen Benowitz learned the hard way that when something feels wrong, it probably is.
Any patient that has any type of pain in the neck or the jaw, or the chest obviously, my best advice is don't ignore this pain.
It's never too late to reduce your risk factor. Regardless of where you are now, you can always improve your longevity. Don't ever get into the state of mind where you feel, I've gone too far to change. Anyone can change. And the simple things such as increasing your exercise, changing your diet, and treating medical conditions can have a major impact. It's never too late to start.
St. Francis Medical Center is New Jersey's leader in treating heart disease and stroke. Located in Trenton, St. Francis is a referral center for cardiac and stroke care for patients across the state. In fact, the St. Francis Heart Hospital and Stroke Center are the only accredited programs in Mercer County.
I'm very proud of our cardiac and stroke programs because of the quality of doctors and nurses and other healthcare professionals that we have involved in these programs. These programs have been rated the highest in the state for their outcomes in clinical care and quality. I'm very happy to say that there have been many patients in our community whose lives have been restored to full health because of the great work of the professionals involved in these programs.
I would strongly recommend anybody that is experiencing any type of neck pain, jaw pain, chest pain, to probably go to a hospital like St. Francis Medical Center. And the reason I'm saying that is that it is a full service, meaning that they do catheterization, they actually do the surgery.
St. Francis Medical Center boasts a long history of healthcare innovation. For more than 130 years, this hospital has been the site of the area's first X-ray unit and laparoscopic surgery. Today, St. Francis utilizes the latest techniques and technology to treat conditions ranging from cancer to neurology. Yet even as a state-of-the-art hospital, St. Francis Medical Center still upholds the principle of its founders from more than 130 years ago.
The mission of St. Francis Medical Center is consistent with the mission of our founding sisters back in 1874. We are a community of persons dedicated to gospel values to be a transforming, healing presence in the communities that we serve. We treat all people with care and compassion, with a preferential option, though, for those who are poor, marginalized, or underserved in our community.
The medical professionals at St. Francis believe that everybody deserves quality health care. That's why they offer wellness programs designed to meet the needs of Trenton's uninsured and underserved population.
One of the programs that we offer is the St. Clair van. It's a very large van that goes out into the community to meet the needs of the people that are unable to get to the hospital. And on the van there is a registered nurse practitioner and or a physician and medical assistants. They are able to do lab work, they're able to do x-rays.
Not only are minorities at a higher risk of developing cardiovascular disease because of hereditary issues, but there are certain social issues that make them receiving care a little more difficult. St. Francis Medical Center is committed to providing medical care in this urban setting, regardless of the patient's ability to pay.
St. Francis provides over $15 million in charity care. Several of the ways that we do that is in our clinics. We have a medical clinic that serves the adult population. We also have many subspecialty clinics. We also have a walk-in clinic, which is a clinic that is to serve minor illnesses, minor injuries. The patients can walk in anytime and be seen by a nurse practitioner or a physician.
As St. Francis Medical Center makes advances in the healthcare field, it will continue to help eliminate treatment disparities in the Trenton community.
St. Francis Medical Center is working with other local healthcare providers and the City of Trenton to develop programs in the community that will be able to meet their healthcare needs.